I come to him for the nutrients. When you look and you're trying to find the nutrients for you that are correct to use or that your body needs, as opposed to something that just gives you more energy or whatever. It's really tough out there trying to figure that out, and he's helped me just peel away the mountains of information out there and go right to what we need. And he has a line of the very high quality nutrients that I've been using also that I find are very good, and they have been very helpful again in my blood pressure and healing. And these it's hard to find good quality stuff that's and it's not overly priced and things, and it's hard to find the good quality stuff and it's made together and formulated correctly, and that's one of the things they have here is a really good package of quality products that it fulfills a lot of the needs. And when I come here also, I'm able to do my blood tests and things, which is super convenient, and the people are great. Just really good service, and from a doctor's standpoint, I mean, they're top quality, extremely high quality. I've worked with doctors a lot over the years, and these guys are some of the best. So I'd like to just say thanks, Dr. LeBeau, and I'm a lot healthier, and I feel like I'm in the process of getting healthier. Not to a point that's okay, I'm here and that's it. I feel like actually I can even improve more and grow more and heal more. Well, if you have chronic health problems, one of the things that Dr. LeBeau, osteopathic doctors can work on with you is the OMT and helping you figure it out. It's a more natural way. The drugs and things that you use have a lot of side effects and other issues of addiction and things like that. The OMT is a great way for pain. When you're doing pain, there's many benefits in that area. And one of the benefits of an osteopathic technique that you do, the osteopathic medicine, is that you understand, you Dr. LeBeau, understand the drugs that the medical doctors use. And so you're not just somebody who is good with supplements and is trying to bring you over from drugs to supplements, and without really knowing what the drugs are. You have the education and background to totally understand and prescribe the drugs. I know that personally, and I appreciate this immensely, that you prefer to do a natural program and to try to avoid the drugs. And I am very much into that. If you're have chronic problems and pain or any other chronic issues, and this is what the other doctors a lot of times miss, is what you're eating and what you're supplementing and trying to do to keep yourself healthy while you're going through their program, whether it be cancer or some other pain or something like that. And you are osteopathic doctors and MDs are at the same level, and they can have both work with drugs and the same drugs, so they have to understand them. What you, being an osteopathic doctor, have in your tool bag that's even extra is that you have the OMT, which I find is particularly very helpful with the pain and also diagnosing what's going on and the things that you need. And then also the tests and things that you can do, just like the other doctors, and that you can then get your supplements correct, and also you also have a great place for supplements, so I don't have to go out and search for them and find out which ones are made okay and are quality and don't do that. That don't have the other things in there that you don't want in there. And there's good and bad supplements out there, and so just dealing through that. But then when you are, say, in a cancer program or in a long-term program for pain, and fill in the gaps to help your health improve and stay healthy. If when their therapy, the MD helps, a lot of times they forget your body, and you may deal with whatever you're dealing with, but your body's beaten pretty bad through the process. And Dr. LeBeau is the kind of doctor that will help you keep your body healthy and in the long run, able to heal, keep healing, and keep going on strong. So I see that that's the real benefit of being an osteopathic doctor. I personally have found that the tools you have for me are a much better group of tools with the OMT and your knowledge of medicine and everything for the drugs, so we can manage those and manage the pain when I have my foot problems, and also it manages my organ transfer without drugs. I've been able to, like I say, when my foot was crunched, they gave me some pretty heavy duty drugs I never used, because I had OMT to help relieve the pain and complete the circulation, and he gave me also extra exercises to do that would help keep things moving. And so in that situation, that's where that helped, and he helped. That a regular medical doctor doesn't have those tools in their bag. They can't do that. And they tend to, some of them are getting into nutrients and your health a little bit, but he's been doing it for years and totally understands it, and just a great guy and a great practice, and for me it's just been a real blessing to find him and their practice, and it's been a very healing experience for me. My parents were both doctors. My father taught medicine at some very prestigious places, and so I've grown up with medical doctors throughout my life, and I've had issues with allergies and things when I was a kid, and always going to specialists and things, and so I've been around doctors' hospitals for a lot, and so I had never experienced before the osteopathic, manipulative technique, that OMT, before, and so I wasn't that familiar with it, and so when I had also experienced over the years many different kinds of medicine, acupuncture, chiropractic techniques, and then and like I say, I've been to endocrinologists and cardiologists and neurologists for various things, and that a lot of them were connected to this problem I have with the lead. And it turns out that they were all symptoms. They were chasing symptoms of what turns out to be lead symptoms. And so when I finally came to Dr. LeBeau, he actually looked at me. He talked to me a bit. Quite, he's very personable and easy to talk to. So I come in and talk to him and tell him what's going on in my history, which any good doctor should do, a good history. And so I've learned that from my father. But and he did a very excellent history and found out, my symptoms and what I was doing and what's going on. And we did some tests, and right away he nailed the major cause of most of my symptoms I've been dealing with for the last, I don't know, at least 20 years, and maybe more, depending on where I got. I had an immense amount of lead, a big spike. The other things were not that high, maybe a little high, but the lead was extremely high. And I've never, when I went to say a regular medical doctor, and I'd say, I think I would even, before I've said, I think I got something in my body. It feels like something's weird, that over years of reading stuff and feeling stuff. And they'd say, well, did you work in a lead factory? And I'm like, no. Did you work in a battery? No. Well, and they didn't bother. Dr. LeBeau looked at it and checked things out, and the test was not that expensive. It wasn't like it was a NMR or something. It was just a urine test, actually, and comes back in my metals, and it's done with a mass spec and equipment. And I work with the equipment stuff, so I'm familiar with equipment. And so the mass spec, it's an official equipment they do a lot of diagnostic work with in medicine and other fields. And it comes back, and I got this major thing of lead in my body. So, but my issue is it's been going on for so long. I've been misdiagnosed, and it's been going on so long, it's damaged my kidneys and my liver. And my kidneys were like up at stage 3, and stage 4 is kind of like you're going on dialysis or getting a new kidney. And so so we couldn't do what a medical doctor commonly would do, would stick you on a IV chelation. That would be so fast that it would kill my kidneys. It'd make them actually damage them and take them out soon because they were not healthy. So we went on an oral chelation, which is, you can read about it and it's there, but not a lot of doctors talk about it or do it. It's slower, it's mellower, but it saves your kidneys. And my kidneys may even be improving because when you read about the lead in the blood, it comes out and it raises blood pressure, and it causes your kidneys and liver to not function well, to function less. So if you pull the lead out, you may actually get back some of the health to those organs. And he just nailed it, and it wasn't like, oh, we're guessing or whatever. It was like, oh, here we go, take these tests, it's right here, boom, and we started working on it, and that's what we're doing now. And my lead's come down quite a bit. It still has more to go, but it's slow, and my kidneys haven't gotten worse. They're actually maybe doing a little better, and which is unusual in medical field, and so I'm feeling better, I'm doing better, and so dealing with those kind of things. So I'm just really ecstatic about finding this, and the OMT, the osteopathic manipulative technique, to me is a godsend. It's just really great stuff. I don't know why more doctors don't use it more. I know that they can kind of sit back and do the symptom drug-based therapy. It makes, for a business standpoint, it's more cost-effective. Put it that way. That's a nice way to say it. But with the osteopathic manipulative technique, it takes a little more time, but it's very mellow. It's not it's a very calm and relaxing kind of thing, and I just think it's great, and it's helped me so much. And like I say, I measure my blood pressure all the time, and I've seen my blood pressure coming down, and you know, the trends and stuff, and also, like I said, when I had my leg issues, um, and bringing that back, oh, the pain relief was immense, and it just was amazing. It's interesting. It's really a fantastic technique they do, and so I'm just really happy to be here.
I'm Lane Kitzing. I'm 82 years young. I'm still learning and growing and look forward to many more years of holistic health. I've taken supplements most of my life, and I kept trying to figure it out for myself, but I wasn't confident I was taking the right approach. I was looking for someone to consult with for my supplements, to help guide me what to take, when to take it, and how much to take. My general well-being has improved, of course. Dr. LeBeau is working with me on my back and several areas that just aren't working right. And of course, made a major difference in the supplements I was taking and how I was taking them. I was looking for someone that could advise me and take a really healing approach with supplements. And Dr. LeBeau is certainly that doctor. You get to the point that you don't know what you're taking for what. It really makes a difference to be consulting with a holistic doctor. All of Dr. LeBeau's recommendations regarding supplements have been based on really factual tests, blood tests, all kinds of tests, and recommendations that then proved a better result. And that's what we're looking for, is healing results and improving our quality of life. The diet, supplements, and exercise that Dr. LeBeau has recommended have made a significant difference in my health. I don't think of myself as a senior. I think of myself as a woman that has challenges, health challenges, but also has a lot to offer and give. But if we're not feeling well, you just can't do it. So I looked to Dr. LeBeau for solutions and got them. My energy is definitely improved. My strength, again, that overall feeling of well-being, and that I'm doing the best I can for myself. You know, we're from a generation that we took care of everybody else. We didn't think what was wrong with us. And as we get older, there comes a time in our life that we might have the money and the resources, most of all, the time, to focus on what we need. And that's where I am right now. I'm trying to be the best I can be in all ways possible. I owe that to myself. Faith is where it starts. The faith that you can get better, that you can take care of yourself and find answers and practice what you need to do. It all starts with faith and belief in God and yourself. No matter how old you are or young, it truly is never too late to become and be the best you can be. That's our responsibility to ourselves. And Dr. LeBeau has helped me do that.
Being married and having my wife available, and that we are both part of an active church, and that we both believe deeply in God, it allows us both to have a commitment to each other, and that commitment has manifested itself in many ways. One of them is that during this time between the disease itself and between the surgeries, I was unable to actually speak clearly of what I needed. When you, the doctor, would ask me questions, I could give an answer, but it would be, well, yeah, I'm fine, whatever, yeah, and it just kind of run down. Whereas she was with me all the time, and she was with me even during this pandemic situation, and saw what was going on, and heard the little things that were going on, and she could speak for me. So being able to have her there was a critical piece of it. And then the church men's group I'm part of has just been a great support. Their prayers, those guys holding me up when I could no longer, again, speak for myself, has been a critical piece of it. We were not created to be diseased, and they brought me before the creator of the universe and prayed for me. So that was a big deal in keeping me, giving me hope again, and giving me a way to see light at the end of a tunnel. Because at the end of the day, there's bits and pieces that have been cut off, and there's cancer that has abilities that aren't really clear, and how it's going to be treated. And it's through faith and an understanding of that you realize that life will go on. The advantage of having the integrative approach and having the osteopathic knowledge has been great for me. It's a much broader way of dealing with me, the patient. So often you get involved in these things, and with cancer, and particularly my particular form of cancer, not a lot is known of this. It's we all like to believe that it's just raw science, and you add 2 drops of this and you'll be better. Well, it doesn't work that way. They don't really know why things are going on. The body, in this case my body, is not doing the things that we hoped it would do, and things aren't quite balanced up right. And being able to come in here and deal with you on both the physical level, the osteopathic level of manipulating bones and flesh and nerves and blood flows. Just after the initial surgery, I was able to come in and was hurting, I was uncomfortable. By the time I left an hour later, I was able to stand up straight and was remarkably better in just feeling. No, was I completely healed? Had everything gone away? No, but I was able to stand up, and I was able to approach the world in a better framework, and that's pretty impressive when it's been multiple weeks or months without being able to do that. Beyond that, having the integrated approach of all the nutrients in your body. We are bombarded with everybody who's got an answer and a secret, this one trick. Well, none of that does you any good. I need a rationale. I need a trained person who has knowledge of it, and that's what you provided. And Mark has been able to answer those questions, and then use different scans, different tests to find where things are not up to snuff, where my body is not producing enough or absorbing enough of whatever nutrient or item we're looking into, that it can be supplemented properly, as opposed to just throwing rocks at it and seeing if something will stick. Not the least of which, with my particular surgery, I am missing parts of the intestine. I can no longer process things properly. So whereas that was not really talked about by the other doctors I see, and I see many doctors, And it's not that they're bad, and it's not that they don't think there might be something to it, but it's not really that important to them. Except that when I do it right, having talked with Mark about this and worked through it, I seem to do better. It's something that I have watched over time. And just to make it more challenging, the body, or my body itself, is changing over time. The initial abilities I had right after surgery are different than what I've got now. There's been some form of compensation within the body, and that's got to be dealt with, and has been through talking with Mark and dealing with the various tests we've gone through, and varying the approach. And some of it has needed more of an osteopathic answer, and some of it has needed more of a diet and supplement answer. But all of that has varied over time. The carry-on benefits of this pre and post-COVID, for lack of a better term, the amount of vitamin D, the zinc, the copper, these things that I understand are termed much of the Walsh protocol. I was deficient in just now, whether it was genetics that led to that, or whether it was because of the surgeries I've been through, or because of the drugs I'm taking relative to cancer and chemotherapy. All of those could have been part of the reason. But the nutrients and the zinc and these have all proven to be important aspects of dealing with the COVID virus. And I am taking them regularly. And as we found out when this virus cropped up, it was a critical part of it. Since I was at a low ebb and susceptible just because I was not in the best of health, it's been a good thing for me, A, to be up on these things, and B, I have not particularly worried about it. Now that is a combination of both faith and the treatments I'm getting because of my coming here and dealing with Mark as part of a holistic or whole body method. But I was prepared to walk into it as well as I could be prepared, given that nobody wants to have that virus going on. As far as the bigger picture and the hope for the future and hope in the midst of living with this disease, it's faith. It comes to faith as a foundational element, and then beyond that, it's working with people who are within that faith, who understand where God is involved in it, but also have the skills that they have trained for and gotten over years. The broader osteopathic help, the broader nutrient help, the integrative idea that we're going to deal with the entire body on this, as opposed to just try and kill some little thing that's in there that isn't right. There are many aspects to living and continuing on while this disease exists, and some of it is part of the course of healing from surgeries. Some of it is part of learning how to deal with each other. My wife and I learning how to deal with each other now that I'm not doing some things and she's doing more things. And some of it is having someone you can rely on to talk about, well, what can I eat? What would help to eat? What can I deal with? Gee, I'm feeling this, or I'm not feeling that, or a myriad of little questions that can be answered with a broader approach like this. And because of that, you can take steps. You can take small steps forward and realize there are some help, and then begin to actually feel that help. So yeah, I would recommend this kind of thing to anybody who's going through a cancer situation or any major surgery for that matter. The relief I felt after that surgery is very important, and the knowledge that I am not just going on my own and making it up as I go along. There are many, many voices out there who are happy to tell you their internet truth. And the internet, as we know, has got the same validity as an open sewer and will drag you right down that. Having someone that is both a man of faith and a man of science and a man of skill with experience over a long period of time dealing with cancer has been a critical piece for me. The ability for my wife to have somebody she could talk to and ask medically oriented questions, questions relative to living with this disease and what she could do, having Mark available as that resource has been the other side of this coin, has been a key part of keeping us going together.
So as I'm holding here, on a 1 to 10, how much discomfort?
It's a 5.
Okay. So we're going to, actually I want to take just a break for a second. I want to get to that spot. Around there.
Yep.
That's
there
it?
we go.
Okay. Okay, so on a 1 to 10, how much pain you feeling here when I'm pushing?
Yeah, we're good 5, 6.
Okay. So we're going to try a different position. We're going to try bringing forward. How much pain here? Is it a little better or worse?
It's a little better.
Versus how about here?
It's a little worse.
Okay. So, and then to this side?
It's a lot worse.
This side?
It's about the same.
Okay. Turn towards me.
About the same.
Turn away.
And that's a little less.
Okay. So now relax here. How about how now?
That's a little less.
How much on a 1 to 10?
If it was 5 before it, we're probably down to 4 going down.
Okay, let's hit the arm. How about now?
We're at 3.
Now?
2, 3.
Okay. So we'll just hold it there. So this is a myofascial release technique. So what we're doing is we're putting it in different directions, trying to take the pressure off of the nerves and tissue, allowing it to relax. And in the time that we're allowing to relax, it allows both the muscles physically to relax, as well as the nerves electrically to relax. And my feeling is, additionally, to allow some of the fluid, because I think that what happens is there's a little local swelling that occurs at these spots that keeps the nerves turned on. So it's sort of like a switch stuck in an on position. How are we doing now?
Good.
How much?
Good. Down to 1.
Okay. And usually it takes about 90 seconds or so, so a minute and a half, 2 minutes. And then for my side of the coin, I'm going to keep my finger here for a couple reasons. Number one, I want to assess what I'm feeling. Number two, when I get you back to the starting position, I want to make sure I'm on the right spot, because sometimes people says, well, that's less pain, but you're touching a different area. Well, no, not. There's no magic tricks. I'm not moving my hands. So that won't change. So what I'm looking for here is some tightness or tension in the tissue to resolve. And like I say, it takes about a minute and a half to 2 minutes. And again, this is called myofascial release technique. It's a good soft tissue technique. It can be done, as you can imagine, just even in acute situations, just after surgery. Like I had mentioned to you prior to your surgery, I look at surgery like an an elective surgery anyway, like an elective car accident, because body goes through the same trauma, only like you adequately observed from your personal experience. A lot of times, doctors take it as a routine because that's what we do, but when the patient gets out of it and the anesthesia wears off, then oh boy, even simple things like standing straight. And if you were having problems like that, any problems after surgery like that, then that's also not only going to have a physical aspect, that pain, that uncomfortable is not only a physical aspect, it also is relating to the blood, nerve, and lymphatic circulation. So as you're freely moving better, and with less pain, it also means that you're getting better blood, nerve, and lymphatic circulation. And one other thing I hadn't mentioned to you before is that one of the things I find beneficial for working with physical medicine, the osteopathic approach around the areas of surgery, is, in my experience working with patients with cancer, is that one of the interesting things is oftentimes cancer reoccurs oftentimes at the site of where the scar was, or where the porous circulation is. So, okay, we're going to have you sit back up again. 1 to 10, how much pain?
We're down to 4 there now.
Okay. So let's try a little. And how about now?
We're down to 1 again.
Okay. So we're going to do this one more time. But another interesting aspect of this approach is when I find a position like this, in this case you're forward bent, twisting a little bit to the left, I'll have a patient reproduce this position, getting in a chair at home, and you can continue this. You can do it 2 or 3 times a day for 2 to 5 minutes. The key is you just need to be relaxed. In other words, you shouldn't be, when we're doing a release technique like this, you shouldn't feel you're having to hold yourself up, because if you're holding or bracing yourself too much, then that means that you're tightening some muscles. And so, if we think of the word release, we want everything to be as rested as possible and as much at ease as possible.
Makes sense.
So that's the particular nice thing about these techniques is occasionally when I find other positions, I'll give that as part of the patient at home exercise, because then they can continue the benefit between visits. Okay, so one more time. How about that?
We're down to 1.
Okay, so
There we go.
that's myofascial release.
And it released.
Now this area is important because we're dealing with the liver area here. So, and also, we're under the diaphragm. So about 60% of your digestive organs are under the diaphragm. You got your stomach here, pancreas here, liver, gallbladder here, first third of the small intestine, and then the small intestines will wiggle around, and then you get ideally in the optimal situation, like when you're young and born before colon surgery, the colon would go up, across, and down. So sometimes so the point is it will oftentimes be part of the colon area. So so much of digestion will be affected by any kind of restriction in this area. And then of course on your lymphatics, the lymphatics have to return back up into the chest. So any imbalance like that. So we want to keep everything moving as well as possible. Okay?
Makes sense. So there we go.